A very good morning to one and all. Welcome to Common Yoga Protocol training conducted by National Institute of Naturopathy. Today, prior to the training, we will be chanting the 27th and 28th Sutra of Kaivalyapada of Maharshi Patanjali. Tachidreshu pratyayantaraणि samskarebhyah. Any gaps in discriminating awareness allow distracting thoughts to emerge from the store of latent impressions. The word pratyaya is used to describe the total content of the mind which occupies the field of consciousness at a particular time. The ordinary mind perceives objects as contents. Pratyaya is thus a limited dualistic mindset through the action of karma, klesha, vasana, and samskara. Hanamesham kleshavaduktam. These distractions can be subdued as the causes of suffering were by tracing them back to their origin or through meditative absorption. Likewise, those samskaras which create kleshas can also be eradicated by the same previously mentioned remediation procedure that were used with eradicating the kleshas, samskaras, vasanas, and avidya. Let us now move on to the practice of Common Yoga Protocol. Thank you.
Hello everyone, I'm Dr. Praveen C. Madhav, working as a medical officer at National Institute of Naturopathy, Pune. Today we are going to practice Common Yoga Protocol issued by Ayush Ministry. Let us start the session by chanting prayer. Gently adopt any comfortable meditative posture in Vajrasana, Sukhasana or Padmasana, whichever is convenient for you. Slowly join your hands in Namaskara Mudra and close your eyes. Slowly inhale and chant Omkara once, followed with the mantra. Inhale. Sangachatvam samvadatvam sambho manamsi janadam deva bhagam yata purve sanjanana upasate. Now slowly drop your hands down. Come to standing sthiti position. Let us practice loosening exercises. People who are suffering with cervical spondylosis, low back pain, and cardiac diseases and arthritic conditions should not practice these loosening exercises. Let's go for the neck rotation, neck movements. Slowly place your palms on the waist region. Look forward. Let's start with neck movement, starting with bending your neck towards the right and left. Slowly inhale. Bend your neck towards the right. Inhale and come to center. Exhale towards the left. Inhale and come to center. Exhale towards the right. Inhale, come to center. Exhale towards the left. Come to center position. Now let's practice sideward looking. Now slowly inhale. Exhale and turn your neck towards the right side. Inhale and center. Exhale towards the left. Inhale towards the center. Exhale towards the right. Inhale towards the center and relax. Now slowly we'll go for forward and backward movement of your neck. Inhale, throw your neck backwards. Exhale and slowly bend forwards. Inhale backwards. Exhale forwards. Now slowly come to center position. Let's go for neck rotation. Now slowly from the right, inhale, bend backwards and slowly bend forwards by exhaling. Inhale backwards, exhale and slowly bend forwards. Once again, inhale, bend backwards, exhale, slowly forwards. Now let's go for anti-clockwise rotation towards the left. Inhale and exhale. Inhale and exhale. Inhale and exhale. Now slowly come to center position. Release your arm and relax. Come to standing position. Standing sthiti. Let's go for shoulder movement. Now slowly rise your both the arms by sideways, horizontally, up above your head, palms outward, straight, and slowly release it. Slowly with single inhalation, rise it up once again. Exhale, release it. Inhale and rise it up. Exhale and release. Feel the changes in the shoulder joint. Now slowly we'll go for the next movement. Slowly bring your both the arms in front of your chest. Bend at your elbow joints. Place your palms or fingers on the shoulder. Now slowly inhale and expand your chest by throwing your both the arms backwards. And slowly exhale and forwards. Inhale, expand your chest. Exhale, slowly touch your both the elbows forwards. Inhale, expand your chest. Exhale, slowly touch your elbows forwards. Inhale once again, last one. Expand, exhale and touch. Now slowly anti-clockwise. Inhale, exhale. Inhale and exhale. Inhale and exhale. Now slowly relax. Now let's go for the trunk movement. Now slowly spread your both the feet apart a bit. Now slowly rise your both the arms in front of your chest. Now inhale, exhale and twist it towards the right so that the left palm touches the right shoulder. Now slowly inhale and come to center. Exhale and twist it towards the other side. Inhale and come to center. Exhale towards the right. Inhale and come to center. Exhale towards the right. Inhale and come to center. Exhale towards the right. Inhale and come to center. And to the left. And slowly come to center position and relax. Relax for a while. Now let's go for the knee movements. The squattings. Now slowly have a comfortable feet placed on the ground, a little bit apart. Now slowly lift your both the arms in front of your chest. Inhale and slowly as you exhale, bend at your knees and try to sit a bit. Now slowly inhale and come up. Exhale and sit. Inhale and come up. Exhale and sit. Slowly come up and relax. Now let's practice standing series of asana. The first asana which we are going to perform is Tadasana. Tadasana brings stability and firmness to practice all the asanas. Now let's go with the practice. Standing sthiti. Now slowly spread your both the foots a little bit apart. A little bit apart. Now slowly interlock your fingers and place both the palm in front of the chest. Keep your focus on one single point in front of you. Now slowly, on a single inhalation, lift your both the arms up above your head and try to maintain the balance. Lift your toes off the ground and try to maintain the balance on the toes. Look at one single point and try to maintain it. Now slowly release your arm and release your leg. Come to standing sthiti and relax. People who are suffering with varicose veins and acute heart diseases should not practice this asana. Practice the second standing series of asana, that is vrikshasana. Vriksha means tree. The final posture of this asana resembles the tree posture. Now let's get into the practice. Now, from standing sthiti, slowly keep your both the arms beside your thighs. Now slowly bend at your right knee joint and place your right foot on the left groin region. Now slowly rise your both the arms horizontally upwards above your head and make a namaskara mudra above your head. Keep looking at one single point in front of you to maintain the balance. Try to maintain the balance. Now slowly release the posture, release your arms and then your legs. Now let's practice vrikshasana from the left side. Fold out your left knee joint, place at your right knee joint. Now slowly rise your both the arms above your head, make a namaskara mudra above your head. Look at one single point in front of you and try to maintain the balance. Now slowly release the posture, release your arms and then your legs. Come to standing sthiti and standing relaxation position. Vrikshasana helps to tone up your leg muscles, improves neuromuscular coordination. People who are suffering with vertigo, obesity, and heart diseases should not practice this asana. Now, let us practice Padasana. Pada means feet, Hasta means palm. In this posture, we are going to touch our both the palms to our feet by bending forwards. Now, let's get into the practice. Now slowly come to standing sthiti and leave a half a 2-inch gap between your feet. Now slowly as you inhale, raise your arms in front of your chest and above your head. Slightly bend backwards. As you inhale and as you exhale, slowly bend forwards, placing your both the palms beside your both the feet and touching your forehead to your knees. Try to maintain the posture. Now slowly inhale and release and come back in the same way and relax yourself in sthiti position. Padasana helps to improve your indigestions, relieves constipations, and people who are suffering with hernia, abdominal ulcers should not practice this asana. Now let us practice Ardha Chakrasana. Come to standing sthiti. Now slowly place your both the palms on the waist region. Now slowly as you inhale, bend back starting with your neck and a bit of upper back. Try to maintain the posture. You can close your eyes while balancing or you can look upwards or backwards. Try to maintain the posture and slowly release. Ardha Chakrasana helps you to improve your spinal muscles, relieves the pain in cervical spondylosis. People who are suffering with vertigo, hypertension should not practice this asanas. Now, let's practice Trikonasana. Trikonasana means a triangle posture. A triangle made from the limb and the trunk. Now, let's get into the practice. Now, slowly come to standing sthiti. Spread your both the feet apart. Turn your right foot to right side. Inhale and lift your both the arms by side. And slowly as you exhale, bend towards the right side and try to place your palm on the right foot. And look at the tip of the left palm. Try to maintain the posture. Now slowly release in the same way. Release your arms and then your legs. Now let's practice Trikonasana in the left side. In the same way, spread your both the foot apart. Left foot towards the left side. Now slowly inhale and rise your both the arms horizontally. Now slowly exhale and place your left palm on the left foot. Look at the tip of the right palm above your head. Maintain the posture. Now slowly release and relax in the same way. Release your arms and then release your legs. Trikonasana helps you to improve the strength of your legs and the flexibility of your spine. People who are suffering with acute back pains and arthritis issues should not practice this. Now, let us practice sitting series of asanas. Please come to sitting sthiti. You can relax in sitting relaxation position. Now let's practice Bhadrasana, the auspicious pose. Now, slowly come to Dandasana, join your both the legs, keep your palms beside your both the hips. Now slowly, one by one, fold your both the legs at the knee joint and place it near your perineum. Now slowly interlock your both the palms and hold your toes. Keep your spine erect. Focus at one single point in front of you, or you can close your eyes. Now slowly release the posture, release your palms and then your legs. Bhadrasana is very helpful for people who are suffering with menstrual problems and the cramps or abdominal pains which is happening during the menstrual cycles. People who are suffering with severe sciatica and arthritis pain should not practice this asana. Now let's practice Vajrasana. Now slowly come to Dandasana, join your both legs, arms beside your hips. Now slowly fold at your right knee joint and place it below your buttock. And same thing with your left. Fold it and keep it below your buttocks. And place your both the palms on the knee joint. Keep your spine erect, close your eyes and relax. And maintain the posture. Now slowly release the posture. Place your leg one by one and relax in sitting relaxation position. Vajrasana is very helpful to improve your indigestion and constipation. People who are suffering with piles or other severe arthritic issues should not practice this asanas. Now let us practice Ardha Ustrasana. Now slowly come to Dandasana. Adopt Vajrasana by folding your both the knees and keeping your ankle or foot below your buttocks. Now slowly stand on your both knees, keeping a slight gap between your both knees. Now slowly place your both the palms on your buttocks or the waist region. Now slowly with single inhalation, bend backwards as much as possible. Try to be very much comfortable when you are bending backwards and maintain the posture. Now slowly raise your posture, come forwards, inhale and slowly adopt Vajrasana and relax. Ardha Ustrasana helps you to improve your spinal and the cervical muscles. It is very much good to improve your digestion and very much beneficial for persons who are suffering with heart problems. People who are suffering with hernias and severe back pain problems should not practice this asana. Let us practice Ustrasana. Now slowly adopt Vajrasana and slowly stand on your both the knees. Place your both the palms beside your hips and slowly with one single inhalation, raise your both the palms above your head and place it on the heels of both the legs. You can close your eyes and the final posture, maintain and slowly release the posture and relax in Vajrasana. Ustrasana is very much beneficial for improving your strength and flexibility of your spine and the spinal muscles. People who are suffering with hernias, abdominal injuries should not practice this asanas and hypertension. Let us practice Shashankasana. Now, gently adopt Vajrasana and spread your both the knees slightly apart. Open your perineum region and place your both the palms on the floor. And slowly move a bit forwards and right stretch your whole back and place your whole chest region on the floor and try to relax. Observe the contraction in the leg muscles, a stretch in the anterior and the posterior part of your body. Maintain the balance. Have a normal breathing. Try to maintain the posture. And slowly come back by placing your palms on the ground, moving backwards, and slowly sit and adopt Vajrasana and relax yourself. Shashankasana is very helpful to prevent any back pain and relieves back pain if you're suffering from a long time. An acute back pain areas or acute back pain problems when it is existing, you should not practice this asanas. And people who are suffering with high blood pressure should not practice this asanas and take a caution. Slowly, let us move on to the practice of Uttana Mandukasana. Come to Vajrasana or sit in Vajrasana. Slowly spread your both the knee joints away from the perineum region and try to place your buttocks on your heels and sit comfortably. And slowly inhale and raise your both the arms and fold at your elbow joint. Place your right palm on the left shoulder joint and left palm on the right shoulder joint behind. Cross each other and try to close your eyes and observe the breathing. Try to maintain the balance and the posture. Observe your breathing, a normal breathing during the practice. Practice how much ever you are comfortable with. Don't strain yourself. And slowly release the posture by releasing your arms one by one from the up. And slowly release it and relax. Release your posture. And relax in Vajrasana. Now, we'll practice Makarasana. Before going to Makarasana, the benefits of Uttana Mandukasanas are It improves the flexibility of your spine, tones up your back muscles and your shoulder muscles. Now, let us practice Vakrasana. Adopt Dandasana slowly. Join your both the legs. Place your both the palms beside your hip region. Now, gently fold out your left knee joint. Place your left foot beside the right knee joint. And slowly lift your arms up and overcross your right arm and twist your whole body as you exhale. Exhale and twist the whole body. And have a normal breathing. Place your right palm on the right left ankle joint. Place your left palm on the ground and look back. You can close your eyes when you are adopting the final posture. Observe the contraction or the twist in the abdominal region and the stretch in the back region. Try to maintain the posture. Now slowly release the posture. Release your arms and release your legs. Let's practice Vakrasana from other side. Now slowly fold out your right knee joint. Place your right foot beside your left knee joint. Inhale and lift your both the arms by side and overcross your left hand. And place your left palm on the left knee joint or ankle joint, sorry. Place your right palm on the ground. Feel the twist in the abdominal region and the stretch in the back region. You can close your eyes when you're adopting the final posture. Maintain the posture. Feel the stretch and the contraction. Have a normal breathing in the final posture. Now gently release the posture, release your arms and then release your legs. Relax in sitting relaxation position. Vakrasana helps to improve your spine flexibility. A very good asana to balance diabetes mellitus, back problems, and if you are suffering with any chronic abdominal ulcers or hernia or recent abdominal surgeries, should not practice this asana and have to take a caution. Now, let us practice prone series of asanas. To practice prone series of asanas, person who are suffering with or who is having some abdominal surgeries or suffering with hernia or ulcers should not practice this asana, should take a caution. All these asana will improve the strength of back muscles and cervical muscles and tones up your neck and back and leg. Let us move on to the practice of prone series of asana. Come to sleeping sthiti. Joining your both legs, keeping your both the palms beside your hip regions. Now, let us practice Makarasana. Gently spread your both the legs outward, foot facing outward, and place your both the palms above your head, fold it, and place your forehead on the palms and try to maintain the posture. Normal breathing when you are maintaining the posture. Concentrate on the back region and the abdominal region and try to have a normal breathing. And slowly come to relaxation position. Release the posture one by one. Leg arm and come to Sthiti. Now, let's practice Bhujangasana. First, we'll practice Sarala Bhujangasana and we'll practice Purna Bhujangasana. Now, let's go for the practice of Sarala Bhujangasana. Joining your both the legs, keeping your both the palms beside your chest. Here, the elbow should be touching the ground in order to practice Sarala Bhujangasana. Let the elbow be rested on the ground. Slowly inhale and lift your neck above the ground. Slightly upper back. Give a contraction in the upper back. Slightly. And try to maintain the balance. Feel the contraction in the back region and feel the pressure on the arms. And try to maintain the balance. Close your eyes if you want. Try to maintain the balance. Concentrate on the back region and the pressure on the legs and arms. Normal breathing. Maintain the posture and slowly release the posture. First the neck and then the arms. And try to relax. Now, let's practice Purna Bhujangasana in the same way. Place your both the palms beside your chest. Gently lift your, inhale and lift your neck up, upper back up, and try to maintain the balance. Try to maintain the posture. Normal breathing. Concentrate on the back region, the pressure on the arms and the legs. Try to maintain the balance. Have normal breathing and slowly release the posture, starting with your neck, upper back and the arms. Release and relax. You can relax in Makarasana position. Now slowly, let's practice Shalabhasana, the locust pose. Come to Sthiti, join your both the legs, keeping your hands beside your hips. Now slowly, place your palms inside your groin region. Below your thighs, it should be placed, and gently place your chin on the ground. And slowly with one single inhalation, lift your both the legs up above the floor. Try to maintain the balance. Concentrate on the legs and the back region. Try to maintain the posture. Slowly release and relax. Release your legs and then release your arms. And slowly relax in Makarasana. Now, slowly, let's move on to the practice of supine series of asanas. Slowly join your both the legs, place your arms, and slowly come to supine Sthiti. Join your both the legs. Keep your arms beside your hip regions. Let us start with the practice of Setu Bandhasana, the bridge postures. Now slowly fold out your both the knee joints. Place your foot a little bit apart. And slowly, if you can, catch hold your heels. If you cannot, please place your palm on the ground itself and try to practice. Now slowly, with one single inhalation, try to lift your hips off the ground and try to maintain the balance. Try to maintain the balance. Concentrate on your back muscles. to maintain the posture. You can close your eyes if you want. Observe the contraction happening in the back region and the stretch happening in the abdominal region. And slowly release the posture, release your back, place it on the floor, and slowly release your leg and arms one by one. Setubandhasana is very helpful to improve the tone of back muscles and the cervical muscles. People who are suffering with abdominal ulcers or hernias should not practice this asanas. Now slowly, let us move on to the practice of Uttan Padasana. Now gently come to sleeping sthiti. Place your both the palms beside your hips. Both the legs should be joined. And slowly, as you inhale, try to lift your both the legs to 30° and try to maintain the posture. Feel the contraction of the abdomen and the contraction in the legs and try to maintain the posture. Maintain the posture and slowly release the posture by releasing your legs and relaxing. Uttan Padasana will improve the tone of your back muscles and the leg muscles. People who are suffering with abdominal ulcers and hernias should not practice this asanas and have to take a caution. Now slowly, let us move on to the practice of Ardha Halasana. Now gently come to Sthiti. Now slowly, as you inhale, lift your both the legs up to 90° and try to maintain the posture. Have a normal breathing. When you are in the final posture, let the legs be in 90° to the ground, toes facing upwards. Maintain the balance. Feel the contraction in the leg muscles and the back area. And try to maintain the balance. And slowly release the posture by releasing your legs and releasing your arms and relaxing. Again, Ardha Halasana improves the tone of your leg muscles, back muscles. It is very helpful to prevent back pain in future. And people who are suffering with abdominal ulcers or hernias should not practice this asana. You have to take a caution. Now, let us practice Pavanamuktasana. To practice Pavanamuktasana, you have to adopt sleeping sthiti and slowly place your arm beside your hips and lift your both the legs to 90° by inhalation and slowly fold at your knee joint. Bring it near your chest. Hug it by your both the arms around the knee joint. Interlock your fingers. Now slowly inhale and exhale. Touch your forehead, if you can, to the knee and try to maintain the posture. If you cannot touch, please try to maintain wherever you are and maintain the posture. Now breathing in the final posture. Concentrate on the contracted abdominal area and the extended back region. Now slowly release the posture by releasing your neck and releasing your arms and then releasing your legs. Slowly and gently. People who are suffering with indigestion, constipation, this asana is going to work wonderfully for them. And people who have abdominal ulcers and hernia should not practice this asana and they have to take a caution. Even hypertensive people should have to take a caution to practice this asana. Now, the last asana in the supine series is Shavasana. Let us practice Shavasana. To practice Savasana, adopt sleeping sthiti. Slowly spread your both the legs, toes facing outward, palms facing the roof, just half a feet apart from the body. Gentle breathing. You can close your eyes and rest your whole body on the ground and try to relax. Try to maintain the balance. Shavasana helps you to rest and relax the whole contracted muscles, the whole body, and gives a gentle relaxation to your all the joints and releases the tensions from your mind. Very beneficial for the person who are suffering with anxieties and post asana practice. Try to maintain the posture by having a normal breathing and concentrating on the abdomen. Now slowly release the posture, joining both the legs and the hips. Come to sthiti and relax. Now, let us practice Kapalabhati. To come to Kapalabhati, to practice Kapalabhati, you need to come and sit in a meditative posture. Now, slowly, with the help of your right arm, moving it above your head, folding at your left knee joint, turning to your right side with the help of your left hand, gently come up and adopt any comfortable meditative posture. Siddhasana, Sukhasana, or Padmasana, whichever you are comfortable with. Place your hand in Dhyana Mudra by touching your index finger to your thumb and close your eyes. Let the neck and the back be erect and straight. Now slowly inhale through your both nostrils, contract your abdomen and then expel the air out. Active passive inhalation and active exhalation. Keep doing the same thing. Inhale and slowly expel the air out in a strokes manner. Concentrate on the breathing. Try to keep expelling the air out as much as possible. Passive inhalation and active exhalations. Contract your abdomen as much as possible to expel the air out, which you have inhaled. A passive inhalation and an active exhalation by contracting your abdomen. Observe your both the nostrils and the abdomen getting contracted. Slowly stop the practice and relax. People who are suffering with high blood pressure, any cardiac illness, or recent abdominal surgeries, hernia, or ulcer should not practice this asana and have to take a caution. Kapalabhati improves or prevents you getting disease from upper respiratory tract infections or like bronchitis, bronchial asthma, allergic rhinitis, sinusitis. Everything will be prevented if you practice Kapalabhati on a routine basis. Now slowly let us move on to the practice of pranayama. The first pranayama which we are going to practice is Nadi Shodhana. It is also called as Anulom Vilom Pranayama. Let's get into the practice. Adopt Nasikagra Mudra in your right hand, and by folding your index and the middle finger, now slowly close your left nostrils with the help of your ring finger and little finger. Inhale through the right nostril, close your right nostril with the help of your thumb, and exhale through the left nostril. Open your next left nostril and exhale it. And inhale through the left nostril, close it, open the right nostril and exhale through the right nostril. Repeat the same thing. Inhale through the right and exhale through the left. Inhale through the left and exhale through the right. Inhale and slowly exhale. Inhale and slowly exhale. Neck and back straight. Inhale. Slowly exhale. Inhale and slowly exhale. Last round. Inhale and exhale. Inhale and exhale. Stop the practice and release the Nasikagra Mudra. Place your palm in Dhyana Mudra by touching your index and the thumb finger. Nadi Shodhana tranquilizes the mind, reduces your anxiety and stress levels, improves easy breath flow in your both the nostrils, allowing the air to go inside and reach the lungs easily. It cleans up both the nostrils. People who are suffering with allergic rhinitis or congested nose should not practice this asana, should take a caution. Now slowly, let us move on to the practice of Sitali Pranayama. Let the hands be in Dhyana Mudra. Open your mouth and slowly make a crow-shaped tongue, crow-shaped beak with your tongue by holding your tongue and gently inhale through that space, close your mouth and exhale through the nose. Practice, open your mouth, inhale through the folded tongue and slowly exhale and both the nostrils. Inhale and exhale. 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 Stop the practice. Sitali Pranayama cools down the whole body. People who are suffering with hypertension or can practice this asana. That is going to lower your blood pressure, put you in a very good levels of thoughts. It reduces your stress levels and anxiety levels. Observe the changes happening inside the body and your nostrils. Now slowly let us practice Brahmari Pranayama. The first type of Brahmari Pranayama is by just placing your hands on the thighs and just practicing the Brahmari Pranayama. The second type of Brahmari Pranayama will practice with holding a Shanmukhi Mudra. Now let's practice the first type of Brahmari Pranayama. Let the hands be placed in the same manner. Now slowly inhale, and as you exhale, make a humming bee sound and create a resonance in your mind. Slowly inhale and make a humming bee sound. Inhale. Good practice. Inhale. Now gently stop the practice and observe the changes happening in the mind and the body. Brahmari Pranayama helps you to relax and rest and reduce your stress levels. Now let's practice the type 2 of Brahmari Pranayama by adopting Shanmukhi Mudra in your arms, placing it on your face. Now gently place your palms on the face by closing your ears with the help of your thumb, placing your index finger on the eyes, just placing your middle finger on the nose and index finger and the little finger on the lips. Now slowly inhale and make a humming sound as you exhale. Inhale. Feel the resonance in the mind. Inhale. Inhale. Inhale once again. Now slowly release the posture. Release your hands. Place it in Jnana Mudra, touching the index and the middle finger. Let the eyes be closed. Brahmari Pranayama tranquilizes the mind, helps to reduce your stress and anxiety, improves concentration and focus. Now, let us move on to the next practice, that is Dhyana. Let the hands be placed on the thighs itself in Jnana Mudra, or you can place it above your toes and the heels if you want, or else you can place it on your thigh itself. Now slowly move your concentration towards your breathing. Just observe your breathing. Observe the air going inside through your both the nostrils and coming out. Observe the air going inside your both the nostrils and slowly coming out. Just observe your breathing. No other thoughts in the mind. Just observe the breathing. As you inhale, the abdomen bulges out. As you exhale, the abdomen sinks in. Just observe the breathing and try to be very conscious about the breathing and concentrate on your breathing only. Just focus on your breathing, inhalation and exhalation. Just inhale deeply and exhale. Very normal breathing. And just try to concentrate on your breathing only. Try to relax yourself. Just gently stop the practice. It's time to end the session by chanting Shanti Mantra. Adopt a good sankalp in your mind. I help others. I will not cheat anyone. I never lie to anyone. I'll be good to everyone and do good things. Slowly bring your hands into Namaskara Mudra, neck and back straight, chanting Omkara once. Let's chant Shanti Mantra. Inhale. सर्वे भवन्तु सुखिनः सर्वे सन्तु निरामय सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् भवेत्। Shanti, Shanti, Shanti. So drop your hands down. You can rub your both the palms and create a gentle warmness in the palm and keep it on your eyes. And slowly rub your hands down and open your eyes. Thank you. Have a nice day.